guys, my name is Nur Aisyah Carlyani. You can call me Aisyah. Do you have problem about sleep? So I want to share you about it. My goal today is to help you understand about cognitive behavioral therapy for insomnia. Here we go! Okay guys, before starting, I will read the presentation point this time. The first, introduction, the second, discussion, and the third, conclusion. Let's start by looking at purpose and the methods. Purpose, the purpose of this journal is to identify the effectiveness of cognitive behavioral therapy for insomnia patients. The method, 1. Meta-analysis, and 2. Randomized control trial. Now, let's take a look at what is sleep and insomnia. Inadequate sleep and sleep disorder are among the most frequent problems worldwide. Insomnia is the most common sleep disorder affecting approximately 1/3 of the general population. It can have negative consequences on one or several spheres in daily life: psychosocial, e.g., depression, daytime dysfunction, reduced quality of life, occupational functioning, e.g., job absence, reduced ability to do tasks, poor job satisfaction, and inappropriate decision and choices. Are elevated burden to society, e.g., reduced job productivity, increased health costs. Insomnia is described as a dissatisfying sleep associated with difficulty in attaining or maintaining awakening despite good opportunities for sleep, leading to various daytime symptoms. The prevalence of insomnia in primary care patients is as high as 69% compared to 33% in the general population. Insomnia can access as a primary disorder or comorbid with other conditions including depression and chronic pain. In the past, insomnia was considered to be a symptom of this condition, with the assumption that treatment of this primary. There is no evidence to suggest that insomnia often persists following resolution of these primary conditions, and that it generally does not spontaneously resolve over time if left untreated. Insomnia is independently associated with significant morbidity, including fatigue and impairment. Then, I will mention signs and symptoms. 1. Including difficulties in sleep, inhibition and sleep maintenance, waking up too early, non-restorative sleep, and poor sleep quality. 2. When individuals have insomnia problems, they are likely to have impaired QOL because they not to have typical development, energy, resumption, and good psychosocial health, which are all important factors for good QOL. It is important to take care of the patient, to be followed by patient, but it will happen at such a time that there is a lot of work and pain. For to come to the smallest detail, no one should practice any kind of work unless he derives some benefit from it. Then, I will mention about what is cause of insomnia. Insomnia is associated with individuals' later psychological distress, while other evidence has shown that individuals with higher levels of psychological distress are more likely to have sleep problems. A poor sleeping environment such as an uncomfortable bed or a bedroom that's too light, noisy, hot or cold. Lifestyle factors such as jet lag, shift work, or drinking alcohol or caffeine before going to bed. mental health conditions such as depression and schizophrenia. In the next section, I'll show you the danger of ignoring insomnia. In addition, there is evidence that insomnia may confer risks for medical illness including hypertension, heart disease, and diabetes, and is associated with increased overall healthcare costs. If you ignore severe preventable insomnia, you are going to have to face this complication and consequences sooner or later. Reduced job or academic performance, increased risk for automobile or workplace accident. Development of psychiatric problems like depression or generalized anxiety disorder. Now, I'd like to move on to CBT and CBTI. CBT focuses on the effects of individuals' beliefs, thoughts, and attitudes on their feelings and behavior. The purpose of CBT is to educate individuals on how to practically deal with problems or events during their lives. CBT for insomnia or CBTI relies on the general principle of CBT and is designed to relieve insomnia symptoms. The principle of CBTI include behavioral modification such as stimulus control, sleep restriction, sleep hygiene, relaxation training, and cognitive therapy. The goal is to adjust sleeping habits using cognitive strategies to improve thought, feeling, and expectation concerning sleep. Then I will show you about effectiveness, sleep difficulty extremely prevalent health problems with about 33% to 50% of adults reporting regular difficulty falling asleep or staying asleep. About 7% to 18% of adults meet the criteria for an insomnia disorder. Sleep disruption contribute to a variety of medical problems including cognitive impairment, reduced immune function, metabolic imbalance, and exacerbation of psychiatric condition. The most effective non-pharmacological treatment for chronic insomnia is cognitive behavioral therapy for insomnia or CBTI. CBTI produces results that are equivalent to sleep medication with no side effects, power episodes of relapse, and a tendency for sleep to continue to improve long past the end of treatment. The long-term improvements scheme to result from the patient learning how to support and promote the body's natural sleep mechanism. The 5 key components of CBTI are sleep consolidation, stimulus control, cognitive restructuring, sleep hygiene, and relaxation techniques. Then, I will show you about kind of CBTI. 1. Stimulus control. 2. Cognitive restructuring. 3. Sleep hygiene. 4. Relaxation techniques. 5. Sleep consolidation. Moving on the next point, I'd like to share you about sleep hygiene. Sleep hygiene is set of guidelines that promote healthy sleep, including the following. Go to bed at the same time each night and wake up at the same time each morning. Refrain from eating 2 and 3 hours before bedtime. Avoid alcohol 2 to 3 hours before bedtime. Avoid caffeine in the afternoon and evening. Engage in a relaxing evening routine. Expose yourself to bright outdoor light in the morning or early afternoon. Decrease exposure to computer screens and cell phones 1 to 2 hours before bedtime. Not for me, because we are Muslim, we can consume alcohol. To quickly recap, I would like you to remember these key points. CBTI is an effective treatment for insomnia that can produce durable result in a relatively brief number of visits. Low to moderate quality evidence suggests it has greater effectiveness than medication for treatment of insomnia 6 months or more after therapy is completed. Additional research is needed to validate its effectiveness in long-term studies beyond 1 to 2 years and in patients with comorbid insomnia. Additional research is also needed to establish a benefit for CBTI with respect to important psychological outcomes including quality of life. Thank you for your time. I appreciate the opportunity to speak with you today. If you need any further information, feel free to contact me at below. I sincerely appreciate that I had this opportunity to present to you. Thank you guys. Wassalamualaikum warahmatullahi wabarakatuh.